I'm Faye Gephart. I'm a fellowship-trained specialist in female pelvic medicine and reconstructive surgery. Female pelvic medicine and reconstructive surgery is focused on generally women who have pathology of the pelvic floor. Pelvic floor disorders encompass everything that's in the pelvis. So the bladder, the bowel, the vagina, and the gynecologic organs. It's not very easy to talk about, but what I do is anything that leaks or falls out in the pelvis. I believe that we're called to serve those who need it the most, and worldwide women are the most oppressed population. So I knew that I wanted to serve women from the first day that I was in medical school. Beyond that, I have excellent hand skills, so I wanted to be a surgeon. So being a surgeon that helps women, when you're going to treat complex pelvic floor disorders, that means you're going to treat women who have complex problems of the pelvic floor. And so this population fits my needs, my skill set, and my passion. So a native Californian, born, bred, and educated, I went to UC Davis for undergraduate, where I majored in Spanish and neurobiology, physiology, and behavior. I then went to Southern California at Loma Linda, which is an Adventist institution where I got my degree in medicine and also a master's in business administration. Then I went to DC for my intern year and then completed my residency at the University of South Florida in Tampa, and then completed my fellowship with a world-class pelvic surgeon at Baylor Scott & White in Temple, Texas. I came to the Valley because this was the population that I wanted to serve. There aren't many surgeons that specialize in pelvic floor disorders. Really, there's only one other person that's taken the test here in the Valley. And so I came to serve those women in a population where I feel comfortable and I can use my Spanish skills. So if I had a soapbox and I could tell people on the side of the road, women shouldn't have to endure leaking when they laugh, cough, or sneeze, or jump on the trampoline with their kids. It's not normal to have to tell your friends, oh God, don't make me laugh, you're gonna make me pee. You shouldn't have to have bowel accidents. Nothing should be falling out of your vagina, and you should be able to have sex without pain. So that means that you should be able to love without pain, laugh without leaking, and live without fear. A couple of patients have been really inspiring, but most of the patients are most inspiring because many of them come to me thinking that surgery is the only option. And while surgery is an option, and it's a very good option for some women, when we're able to fit them with a pessary or send them to pelvic floor physical therapy and they realize they don't have to live a life where they're wet or leaking all the time, and they can actually go out and jump on the trampoline with their grandkids, or they can go to church without worrying that they're gonna wet their pants. I'm the specialist in the medicine, but the patient is the specialist in themselves. Even if I have all the expertise to know all of the options that are available to the patient knows what they're comfortable with and what their priorities are. So the ability to meet people where they are, determine what their priorities are, and then make a plan for them to achieve their best life, that's what makes a good doctor. So being able to speak with them frankly and laugh about the pathology, but then also educate them, tell them they're not the only person ever that's leaked, whether it's bowel or bladder or had something falling out or having painful sex. Normalizing that for women is really important. And I think most important is for women to know that there's help. You don't have to endure these pathologies. We can help make you better. We might not make you perfect, but we can definitely make you better. My life is grounded in my faith, and my faith is grounded in a specific scripture that says that things were done so that we could live life abundantly. And I want that not only for me, but for my patients. So every patient encounter is focused on making sure that that woman or that person is going to be able to leave my clinic and live the life that they want to its fullest.